A'udzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Now we are going to proceed to our next lecture on the nuclear pharmacy in the hospital settings. So I would say that by now you already know what the nuclear pharmacy is. It is also called as radio pharmacy, where it's a kind of a specialty area of pharmacy practices. It's a patient-oriented, specialized pharmaceutical care services requiring scientific knowledge and judgment for the safe and efficacious use of diagnostic and therapeutic radioactive drugs. Vast activities involved in handling radioactive materials that will be used to diagnose and treat these specific diseases. So, the nuclear pharmacy is a supporting unit in the nuclear medicine services, but kindly take into account that some center in the private hospital, the nuclear pharmacy has been put under the management of radiotherapy or radiology department. How does it relate to other areas of medicine? So, as it is a supporting unit in the nuclear medicine, you can see that nuclear medicine can be divided into three branches, big branches. There are a clinical arm whereby it covers the diagnostic services, the therapeutic services using the in vivo high dose, as well as the interventional services. So, in terms of diagnostic, it's been used the radionuclidic imaging for the planar or SPECT or PET, as well as radionuclide non-imaging, either uptake test, absorption test, or whole body counting, or surface counting, as well as breath test. And previously, there are also bone densitometry services. And then in terms of the therapeutic, we've got the radionuclide that is a beta radionuclide, as well as radiopharmaceutical for the gamma and beta, as well as radioimmunotherapy. For the radiopharmacy, obviously we have to know about the labeling technique, the biochemistry behind of the labeling, the quality control, as well as specific molecular such as binding, kinetic, as well as tumor markers. In terms of the nuclear physics, they involve this radioisotope production, such as our F-18 production by the cyclotron, the instrumentation, such as our dose-calibrated PET-CT machines, SPECT-CT machines, and gamma probe, as well as computer and data analysis that involve in the imaging or scanning of images. The quality control of those calibrators, SPECT-CT machine, and others. So they also cater for the dosimetry for the personnel dosimetry as well as patient dosimetry. And they have to do this mathematical model and involve in the clinical software as radiation biology. So what are those products that we handle in nuclear pharmacy? We have this radiopharmaceutical, it's either diagnostic as well as a treatment. And then we've got this pharmaceutical or common drug for the interventional. So I would say that by now you should fully understood what are the radiopharmaceuticals. They are defined as a chemical substance that contains a radioactive atom within its structure, and it is suitable for the administration to human either for diagnostic or treatment of the disease. So obviously we've got two elements inside those radiopharmaceuticals, our chemical or biological carrier as well as the tracer is the radioisotopes that we've got. So it makes up our radiopharmaceuticals such as technetium-19 and MDP. Yeah? So the radiopharmaceutical use can be categorized into a few ways. Yeah? For the first one is based on their product nature, how are you going to use those radiopharmaceutical. So it can be the sterile radiopharmaceuticals when we're going to inject it intravenously, while it's going to be non-sterile if the patient is going to ingest it orally. And then based on the service nature, it can be diagnostic radiopharmaceuticals or therapeutic radiopharmaceuticals, okay? in terms of the nature of the radionuclide, it can be a naked one, meaning like our iodine 131 or zinc 133, or label compound, for example, our 131 that can be bound with the proteins. So it becomes iodine 131 iodinated proteins, or iodine 131 MIBG, as well as our technetium 19 and M label compound. So for us to make up our radio pharmaceuticals, obviously we have to have this good radio pharmacy practice to ensure that those radio pharmaceuticals that we're going to prepare is actually safe, efficacious, and actually can according to what we want. So this is all the element that we need to adhere to get the good radio pharmacy practices that I will describe further in each of our in our slides. So, good practices for the preparation of radiopharmaceuticals in healthcare establishment. There are various types of radiopharmaceuticals prepared, including sterile product with a marketing authorization, which are aseptically prepared in the healthcare establishment. So, for example, our technetium 19 and M radio-labeled ligands, which obtained by the combination of the kit component with the technetium pertagnetate from a radionuclide generator. This also can be our radionuclide precursors with a marketing authorization, such as the yttrium-90, which are used as a starting materials for the synthesis of yttrium-90 peptide. Oral products with or without marketing authorization, which are prepared as capsules or solution which the patient takes for diagnostic or therapeutic use. For example, the iodine 131 for the thyroid treatment. And we have this inhalation product with or without marketing authorization, such as the gas aerosol or particles. For example, the 81M krypton, technetium 19 and M DTPA, as well as technetium 19 and M graphite. And we have this sterile product with a marketing authorization, which are synthesized, radio-labeled, purified, and are formulated for the diagnostic or therapeutic use. The radionuclides, especially short-lived one, may be produced on site with a cyclotron, for example, the fluorine-18, oxygen-15, or the carbon-11. So alternatively, they can be supplied as radiochemicals. For example, the iodine 123, iodine 124, lutetium 177. And these also cover the germanium 68, gallium 68 radionuclide generator system, which can supply on-site gallium 68 as the PET radionuclide. Preparation of radiopharmaceutical for injection involve not only the appropriate rules of working under aseptic condition, but it's also we also need to adhere to the regulations on the radiation protection. So these two elements is very important to ensure that those radiopharmaceuticals can be prepared efficiently. So in terms of the chapter 1 on the personnel and resources, it has to be sufficient and competent personnel with the necessary education, background, training, as well as experience. And the resources including equipment and facility to enable them to perform their function. So only trained people be responsible and participate. They should have a detailed knowledge of the risk of working with ionizing radiation and have the knowledge of radiological protection. Personnel should be monitored regularly and their exposure to ionizing radiation should be minimized. The preparation and release of product should be carried out by suitably qualified and trained personnel with detailed knowledge of good practice for the preparation, aseptic processing, as well as radiochemistry. There must be a clear separation of responsibilities between the quality control as well as the production activities. The preparation establishment should have an organization chart showing the organizational reporting structure lah. So description of the training and records of completion should be kept. The responsibilities should be outlined in job description, so they have to have a very clear outline on what sort of work they've got to do. New personnel should receive training in all areas that are necessary for the fulfillment of the duties upon recruitment, and also a continuing basis lah. For product prepared from licensed kit and generators in accordance with the manufacturer's instruction, where QC testing is not required, one person could make the product, but the release to the patient should be prepared by an independent person. So we have to apply with this rule, whereby those person who prepare the radiopharmaceutical cannot release the product. Yeah. So all staff should receive training which will provide them with an appropriate knowledge of GMP as well as GPP lah, a knowledge of local practices including health and safety, competence in the necessary aseptic technique or skill. They have to have this knowledge of the pharmaceutical microbiology, because they've got to know what sorts of microbes will appear in the skin or in the personal hair, or even from the personal clothes. Yeah? So at least when we've got this sort of contamination happen, when the laboratory comes out with the results of those microbes available on those particular contamination, we can actually identify from what sources the contamination happened. A working knowledge of the department, product and services provided. So the personnel involved in aseptic processing should have a specific competency and skills in aseptic technique. The aseptic technique should be periodically assessed by performing the media field simulation. So this media field, we are using bacterial growth, media growth. So we will mimic those procedures that we are using every time of the preparation, and then we will actually incubate the media at a certain timing to ensure and to see is there any microbial growth from the process that we have done. So in terms of quality assurance, there has to be a quality assurance unit then that can oversee the preparation operation to ensure that a radiopharmaceutical of a sufficient quality is prepared. In particular, the QA unit should ensure that radiopharmaceuticals are designed and prepared according to the latest state of knowledge. Preparation and control operation are clearly specified and implemented according to the principle of good radiopharmacy practice. And the radiopharmaceuticals are only supplied for use in patients if they have been correctly processed, they have been checked, as well as stored in accordance with the defined procedures and released by a competent person. Adequate measures are in place to ensure that radiopharmaceuticals are released, stored, and handled in such a way that the required quality can be assured throughout their shelf life and in accordance with the in-use expiry date. Okay. Facilities should be adequate to ensure the orderly handling of material and equipment, to prevent the mix-up as well as the prevention of contamination from equipment or product by substances, personnel or environmental condition. All equipment used in production should be appropriately located, so it will help to promote an efficient operation and also eliminate the potential for the errors. So in terms of equipment and facilities, the technetium 99M generator and dose calibration location, they must be adequately shielded to minimize the radiation risk to the personnel. Jadi lead surfaces of the shielding must be covered so it will give less radiation. The needle of the generator must be covered between elution because we just don't want it to be contaminated with a microbe or particle. So we need to use a special vial or caps delivered with the generator. This precaution should be applied according to the supplier's instruction, and the generator should be placed in a grade A environment because we're going to open the needle to the environment, so we just don't want any microbe or particle actually stuck to that needle, and it will enter into the technetium eluate when we are doing the elution. So the dose calibrators also should be properly shielded from bad. So this is how we are doing the elution procedures. So you can see at those bottom images, there's adequate shielding of generators, and also it's have to be an adequate shielding of the technetium eluate. Okay. The preparation area for the sterile radiopharmaceutical, the working area where products are prepared should comply with appropriate environmental requirement. They have to be done under negative pressure together with appropriate precaution against contamination of the medicinal product. For example, appropriate background room air quality, positive pressure airlock system. Ordinary laminar airflow cabinets in usual aseptic pharmacy unit are not suitable for the preparation of hazardous drug. Those that are using in the TPN are not to be used in our nuclear medicine or nuclear pharmacy. So we have to use this biohazard safety cabinet with a vertical downward airflow, exhausting vertically from the cabinet and not towards the operator. Unless there is a proper justification available, the background environment for the laminar flow cabinet and biosafety cabinet should meet the grade B requirement. Whereas if you are using the pharmaceutical isolators, it should be a grade D. Yeah? The aseptic workstation should be sanitized at appropriate interval using the 70% IPA if possible, or other you can find out what is the most appropriate detergent or sanitizer that need to be used. While working under aseptic conditions, the need for radiation protection of the operators should not be compromised. Yeah, because we've got to adhere to both the aseptic condition as well as the radiation protection. Labeling of blood cells should be done in a separate room from other preparation activities. The risk of using common changing room for the two activities should be assessed and documented. So this is happening if you've got quite limited spaces, to make sure that you've got different changing room for those two procedures, the kit-based radiopharmaceutical as well as blood labeling procedures. Then because of the limitation of space, you have to do only one common changing room. So you have to actually validate the process and the workflow of those procedures that have been done to ensure that it's been validated, assessed, as well as documented, so that when you have the inspectors or auditors come in and asking you, you have a proper document to show that the risk is actually low. Yeah. All manipulation of radioactive material should be carried out using aseptic technique within the shielded contained workstation, the hot cell, or laminar flow cabinet, which dedicated for the radiopharmaceutical use. So all surfaces, either walls, floor, tables, as well as furniture, must be made out of materials easy to clean and disinfect, and also to decontaminate in case of radioactive spill. Sink use should be outside the preparation area. It must be qualified to verify that it is installed correctly and it is capable of operating as intended. So we have to have this installation qualification, operational qualification, as well as performance qualification for each of those equipment. Implementation of a preventive maintenance and a calibration schedule to ensure the correct performance of the equipment. Workstation and the environment should regularly be monitored with respect to the microbiological quality. In terms of documentation, a system of documentation must be in operation at the department, allowing the traceability of each preparation, starting from the prescription to the administration of the individual patient doses. We have to have organized in either written or electronic format, and those documents related to preparation should be prepared, reviewed, approved, and well distributed according to the written procedures. And the written procedures should cover all the aspects involved in the process of radiopharmaceutical preparation. It should be include but not limited to material specification and testing, the production and QC procedures, general quality assurance SOPs, as well as cleaning and also maintenance. So records of major equipment use, our cleaning, our maintenance should clearly stated what is the product name and batch number being used. Where appropriate, in addition to the date and time, the signature of the person involved also is very, very important. And this record actually should be retained for at least 1 year. But this is actually go back to the requirement or guidelines that you are following. Some requirements, some guideline, it require you to actually retain the record for 3 years, and some of them require it to be retained for about 5 years. So you have to check based on your facility requirement. So obviously organized written SOP that cover preparation procedures, quality control procedures, as well as the quality assurance procedures. And then it should cover the deviation and changes if there's any process controls involved, as well as microbiological control of aseptic processing and also the sterile filtration. And there need to be a master preparation and also batch records accordingly. In terms of product or kits, it should be checked against the order for correctness of delivery when received. Records of batch numbers and quantities received should be kept. In addition, a visual inspection should be carried out prior to the acceptance. Product or kit with marketing authorization should be used wherever possible. Material should only be used within the declared shelf life. The sterility of the vial should be confirmed through the receipt documentation. In terms of the preparation of radiopharmaceutical, it should be organized in a way that it can prevent the cross-contamination of the product. The process validation, in-process control, and monitoring of process parameters and environment are particularly very important. So in case of there's no licensed generator or product available, you have to do the risk assessment to determine if the product from other country could be used, taking into account any national regulatory requirement. So for us in MOH facilities, if those generator is not registered, we have to apply for the import permit to ensure that we can use at our facility. There should be a procedure for the transfer and sanitization of the generator and any other materials into the preparation area to reduce the risk of contamination. Manufacturer instruction for handling of the technetium generator and pharmaceutical kit are based on the experience acquired with the particular generator or kit. The package insert is approved by the national authorities. It is a prerequisite for a correct handling of a technetium generator and the labeling of kit that the package insert be carefully read and followed. Any deviation from the procedure in the package insert have to be validated as well as approved before it can be used. All rubber stoppers, including those on the eluate vial, must be wiped with a disinfecting agent immediately before the puncture. The solution of the disinfecting agent should be allowed to evaporate completely before puncture. as the introduction of this agent may actually influence the kit performance. So the elution shield and the shield for vials as well as syringes must be checked for the contamination and cleaned inside and outside before it being used, preferably with the 70% ethanol or isopropyl alcohol. The aseptic process has to be validated. New personnel have to be qualified by media field, and all personnel are re-qualified at a regular interval. Transport of eluate and preparation inside the department must take place within the shield. For example, using the elution shield or using the syringe shield. In order to minimize the personnel exposure to radiation, proper shielding is needed, as well as proper planning of the handling for the radioactive products. So the elution shield delivered with a technetium 99M generator should always be used, and technetium 99M solution stored in a suitable shielding lah. And then we have to use the tong or tweezers when we handle the technetium 99M solutions outside the lead shielding, especially when we measure the activity inside the dose calibrators. In terms of the all containers for radiopharmaceutical preparations, including the syringes, it must be clearly identified. So we have to write the name of the preparation, the date and time of preparation, amount of the radioactivity, the volume of it, expiration time, as well as the international symbol of radioactivity. So this can ensure that other people noted that those solution inside that particular shield is actually a radioactive material. The amount of radioactivity and the volume may be written on the label on the lead shielding. In terms of aseptic technique, the personnel should appropriately apply aseptic technique throughout the handling of radiopharmaceuticals for injection, including the radio labeling kits. This implies to the use of special clothing, sterile gloves, sterile vials, sterile syringes, sterile needles, as well as sterile diluents, and that the work is done in a well-planned and expedient way. So we have to ensure that those procedure actually keep as minimum as possible the time that you are dealing with those radiopharmaceuticals. In terms of protective clothing, prior to commencing work in the radiopharmacy, staff should ensure that they wash their hands thoroughly. Before enters an area where radioactive substances are handled, any cut or break in the skin should be covered. Dressing should incorporate a waterproof adhesive strapping. Protective coats or gowns should be worn for preparation and dispensing of radiopharmaceuticals. Disposable gowns offer benefits in terms of maintaining sterility. Glove worn in the laminar airflow cabinet or contained workstation must be powder free in order to prevent clogging of the air filters within the cabinet. Alcohol rub should be rubbed onto glove and allowed to evaporate before entering the laminar airflow cabinet. After handling radioactive material, gloves must always be removed and disposed of as radioactive waste before handling or touching any other material or surfaces within the radiopharmacy. And we always advise our staff to wear a double glove to ensure that you can just throw out the outer layer if there's any contamination, so that you've got another layer inside of those parts. Hands should be washed again after removal of glove. Upon leaving the radiopharmacy, disposable gown also should be removed. Prior to disposal, they should be stored as radioactive waste until monitoring confirm that they are at background radiation level. So we need to monitor that those radioactive waste as actually goes down to background radiation levels. Then only we can throw it as a clinical waste. Critical activities or steps in the procedures that expose the radiopharmaceuticals or surfaces of the container or closures that will be in contact with the product to the environment. So, example of such activities include the aseptic assembly of sterile components such as syringe, needle, filter, and also vial. When open the valve for dispensing, sampling of the sterility test sample as well as sterility testing of the finished products. The working regime recommendation are as follow. The aseptic workstation should be cleaned at appropriate interval, especially before and after use. For example, at our hot cell where we produce our F18 FDG, because it's a very high activities that we are required during the preparation, we just do the cleaning before the synthesis of FDG. After the synthesis, we cannot do anything because we are not allowed to open up the whole cell. So we just let it decay until the next day only we do the cleaning. Yeah, of the workstation. So microbiological monitoring should be performed on workstation immediately after aseptic activities. During sterile component assembly, no additional personnel should enter the room. Items within a unidirectional airflow aseptic workstation should be kept to a minimum and should not interrupt the airflow significantly. Materials entering a grade A zone should be previously sanitized. The surface of non-sterile item, especially the test tube rack, overwrapped for sterile syringes and filters, they should be sanitized immediately before it being placed in the aseptic workstation. So in terms of radiation protection, the control of personal radiation exposure is performed with the approved personal dosimeter. They are regularly checked and their readings are recorded. So this control may be supplemented with the electronic dosimeters, finger dosimeters, and etc. So we have this monthly reading so to ensure how much radiation that we get during the preparation of those radiopharmaceutical. All staff classified as radiation workers must wear a personal dosimeter, the TLD, the film badge, as well as electronic dosimeters. In addition to their regular whole body dosimeter, the staff preparing and handling radioactive materials should wear a finger TLD to monitor the extremity dose. Prior to each use, the TLD should be wiped using an alcohol wipe and worn inside the glove. Upon leaving the preparation area, the finger TLD should be removed and appropriately stored. Yeah, you cannot bring it everywhere you go outside the department. After work, both personnel and workplaces must be checked for radioactive contamination with suitable monitors. Any contamination must be removed immediately or must be contained, and access to the contaminated area must be denied until radioactivity has decayed to an appropriate dose level. So you have to have a clear distinctive sign that those areas cannot be entered until the radiation goes to the background level. Before starting the preparation and dispensing of radiopharmaceuticals, all the materials required should be assembled and placed in or close to the contained workstation or laminar airflow cabinet. Care must be taken to prevent the spillage from occurring. All manipulation for dispensing radioactive material should be carried out over a drip tray in order to minimize the spread of contamination due to breakage or spills. Should a spill occur, then it should be cleaned up properly before proceed any further. All items that might be contaminated should be removed from the affected area and stored safely. Care should be taken doing this in order to minimize the spread of contamination. As with all spill, it is more convenient to allow natural decay to take care of the contamination if the items are not required immediately. So what we use to do is that we let it decay, put it or store it somewhere until it decay to the background level, then you can actually use it back again. For those items that are needed, they should be cleaned with alcohol swab, taking care not to spread the contamination, or you can use the decon or radiate wash. Using multiple swab which are then disposed is the most effective way to remove the contamination. In terms of the quality control, the specification and quality control testing procedures for most of the currently used radiopharmaceuticals are given in the pharmacopoeia. There should be a written procedure detailing all preparation as well as quality control data that should be considered before the preparation is dispatched. So a procedure should also describe the measures to be taken by the responsible person if any unsatisfactory test results are obtained. So for example, in our daily activity, sometimes we experience that the radiochemical purity is actually failed. So what we did, we used to have the same person to repeat the QC for about 2 or 3 times. If she or he get the same data results, we will ask other person to repeat it. If the same results came out, we might then prepare the new radiopharmaceuticals. So examples, the quality control parameters of the eluate for the technetium generators, they are the molybdenum breakthrough, and then the elution activity must also be measured on the each eluate, as well as we have to do this alumina breakthrough. So quality control parameters of kit for labeling with technetium 99M and resulting radio-labeled preparation, they have to be checked upon integrity upon receipt. The RCP testing of product prepared from a licensed labeling kit should be performed on each preparation. For the unlicensed radiopharmaceutical, whether purchased as a finished product or prepared from an unlicensed kit or prepared according to in-house formula, it should be fully tested on each occasion. Sterility should be controlled on a random sampling following the decay of radioactivity. The particle size of particulate radiopharmaceutical used for lung perfusion imaging or particle sizing of colloidal radiopharmaceutical, it may be valuable in ensuring a consistent pharmacokinetic of the product. So this might involve the light microscopic method or even a membrane filtration method. The preparation of radiopharmaceuticals and their quality control should, if possible, be performed in separate rooms. The measurement of pH using a narrow range pH paper may be undertaken on the technetium generator eluates and on products known to have a non-physiological pH or products for which the pH has to be adjusted during the labeling procedures. Sterility and bacterial endotoxin testing. The purpose of sterility testing is to ensure that the procedures used in the radiopharmacy results in the sterile products. The frequency of testing need depend on the experience of the department. We used to have it done regularly, but then if we identify that the sterility products is okay, that then we can actually make it more what we say it need to be done as regular as previous plan. The aseptic preparation and dispensing procedures should regularly be checked, especially if new personnel are involved. Usually the sample for sterility testing are stored for sufficient radioactivity decay, and then it need to be sent for sterility testing by an external validated laboratory. So pyrogen or bacterial endotoxin testing of radiopharmaceutical is not routinely carried out. The loud test may be usefully employed as part of the validation of new system or changes in the working practice. So it need to be done regularly lah. When one or more column purification are involved in the preparation of radiopharmaceuticals, a bacterial endotoxin test must be performed on the final preparation. The procedure should be validated before introduction in routine use, and preparation may be released for use before completion of the bacterial endotoxin test, because it requires a longer time for the results to come out, and most probably when the results come out, you already have the product decayed, so there's no use of waiting until the results come out. In terms of environmental monitoring, it is crucial to maintain an aseptic conditions. The microbiological testing of the clean room and aseptic workstation should be performed periodically. The methods can include using swab or contact plates for surfaces or settling plate, as well as dynamic assemblers for air quality. So what is the purpose of doing this environmental monitoring? It's actually a critical process within the pharmaceutical preparation. It's to determine the microbial and particulate content of clean room air and surfaces. It highlights conditions contributing to excessive microbial and particulate level due to ineffective cleaning or personnel as well as equipment issues such as stranding. It's to alert to conditions exceeding the classification, as well as it's a proactive tool for the quality assurance. The responsible person should take a formal, recorded decision of approval before a product is released for the finished radiopharmaceutical controls and acceptance criteria. So the responsible person should not normally be the person who prepared the product, although there may be no alternative. So the responsible person should be suitably trained and have documented evidence of competence. There should be a written procedure for dealing with products failing to meet the required standard. Such event should be investigated and measures are taken to prevent a future event, and this process must be documented. There should be a written release procedure, and release can only be effective if the product complies with all the specification and the product has been prepared according to the good radiopharmacy practice. There should be a written procedure for the recall of defective product, and a log of error or near misses should be maintained so we can identify what is the cause of those recall, if there's any. In terms of the dispensing, it should be individual and nominative. Consider the radiopharmaceutical prescription. All syringes must be identified at least by patient's name, preparation's name, amount of radioactivity at a stated time. International symbol of radioactivity need to be there, so you can actually alert other people that those solution inside the syringe are actually radioactive. After the recommended incubation time has elapsed, patients' activities are withdrawn using this shielded 2 ml or 3 ml syringes kept with the 21G needle. So each patient activity must be measured and recorded in the radiopharmacy log. The activity withdrawn for each patient, it must be within 10% of the required activity at the specified injection time. The patient injections are usually prepared in a volume of 0.5 ml to 1 ml. There are exceptions to this. The manufacturer's instruction on the volume should be followed. Saline may be used to increase the volume if the volume in which the required activity is obtained below than 0.5 or 1 ml. So we can top up it with saline. Once the patient injection is prepared, the needle must be replaced with a sterile needle of the appropriate gauge, and the air in the syringe must be expelled, because when we actually poke the vial, sometimes the rubber might actually stuck at the needle. So, and once we already poke the needle through the rubber septum, obviously it lose it some of this integrity. I mean, mostly it exposed to the contamination. So it is a very best practice for us to actually change it into the new needle before it being injected to the patient. So when expelling the air, ensure that the needle is kept. When changing needle, withdraw the plunger sufficiently so as to pull liquid from the syringe tip. If at any time there is a droplet of liquid visible in the needle cap, replace the needle cap. In each patient injection must be labeled with an appropriate label detailing the patient name, scan type, activity to be administered, date, as well as the time of injection. The quantity of each radiopharmaceutical dose must be determined before administration to patient and must be consistent with that ordered by the physician or as stipulated in the applicable standing orders in the nuclear medicine procedure manual. The quantity of radioactivity dispensed should be within 10% of the prescribed dose or dose range, and the actual quantity administered should be within 20% unless otherwise directed by the authorized physician and recorded in the patient's medical record. Radiopharmaceuticals should be prepared according to the instruction of the manufacturer. The prescribing physician or nuclear pharmacist may deviate from the instruction on the package insert, but in such instances, the physician or pharmacist is responsible for preparing the radiopharmaceutical. It is responsible to ensure that it meets the pharmacopoeia specification. Radiopharmaceuticals should not be used beyond their expiration date or time recommended by the manufacturer, unless the quality control testing demonstrates that the product still meet the specification of the USP at the time of use. In terms of the distribution, the good radiopharmacy practice guidelines are not covered. The delivery of radiopharmaceutical outside of the nuclear medicine department, because they are meant to follow at those local sites only, and it's not meant to actually distribute or transport it out. Yeah. In terms of complaint handling, written procedures should be followed for the receipt and handling of complaint regarding radiopharmaceuticals. So such procedures should include a provision for review by the quality assurance unit of the complaint and of the investigation conducted to determine the cause of the failure. So written record for each complaint should be maintained in a file designated for the radiopharmaceutical complaint. The record should include the name and concentration of the radiopharmaceutical, its batch number, the name of the complainant, the date of the complaint received, as well as the nature of the complaint and the response to the complaint. It should also include the finding of any investigation and follow-up, or a reason why no investigation was conducted, and the name of the personnel who determined these things. So a radiopharmaceutical that is returned because of a complaint may not be reprocessed and actually should be destroyed. So problems with the radiopharmaceutical should be reported to the manufacturer as well as National Pharmaceutical Regulatory Agency of NPRA. In terms of the inspection, the quality assurance system established at the radiopharmacy department should be verified by internal inspection. So this internal inspection of the premises should be done at least once a year. New personnel should be assessed after their training and initial period of independent work. Thereafter, assessment will be on a random basis. In terms of records, all records should be maintained at the radiopharmaceutical laboratory or another location that is accessible to the responsible official and to the government employees designated to perform the inspections or the inspectors. Such record, including those not stored at the inspected establishment, it should be legible, stored to prevent a deterioration or loss, and readily available for review and copying by the inspectors. So all records and documentation referred to the guideline should be kept for the legally required period of time from the date of release of the radiopharmaceuticals. So this is the references that you can actually have a read. With that, I thank you.